Good afternoon, everyone. My name is David Targett. I am one of the graduate assistants in the Office of Gift Planning this school year, and I have with us today Dr. Anthony Longo. How are you today?
Well, thank you very much.
Thank you for joining us. Dr. Longo is going to be our next feature in our Ask Alumni feature. So I was hoping to get us started. You can kind of just give us an introduction and let people know who you are.
Okay, sure. So I'm Anthony Longo. Currently, I'm the director of pharmacy at Royal and Julius Forest Hills, which is part of Northwell Health.
Mhm.
I've been with Northwell Health for just under 9 years now. I graduated from St. John's in 1992, where I studied pharmacy and where I graduated with BS in pharmacy.
Mhm.
From there, I um, did do two graduate degrees non-traditionally. I got my Doctor of Pharmacy non-traditionally, as well as my MBA.
Awesome.
And they were, two essential degrees that for my career path. Um, Following my graduation from St. John's, I did a residency at Brookdale Hospital in hospital pharmacy.
Hmm.
And then I worked in hospital pharmacy and continued working in hospital pharmacy for the past 29 years, going on 29 years, as well as about 11 years working in industry. So a very varied career over I went pretty fast. 29
Yeah.
years went incredibly fast.
Hmm. And you love what you do.
Yes, very much so. I'm very happy to be where I am, doing what I'm doing, and that's a really important thing that I tell new students that work with us.
Hmm.
Uh, you know, I didn't find what I really wanted to do um, until I think much later. And it was probably in the past, I would say 20 years, that I really found what I enjoyed. And that was working in industry as a medical science liaison and being a director of pharmacy in the hospital.
Awesome.
And that's where I really enjoy it.
Yeah. And can you talk to me a little bit about your role as director of pharmacy and clinical service at Northwell Health, kind of like what you do as a whole?
Yeah. So the director of pharmacy is, it's different, but it's kind of similar to what people think about in retail. But we're in a hospital,
Mhm.
right? So I think a lot of people associate pharmacy with the outside retail settings.
Yeah.
As a director of pharmacy, what we do is we take care of patients in the hospital. That's the first thing that we do. We are a much more organized, multidisciplinary team working with nurses, physicians, and that's one of the main things that we do. But overall, our overarching goals are to ensure the compliance of local, state, and federal guidelines and compliance. We look to achieve annual operating goals
Mhm.
with objectives on finance to ensure that we stay within budget. The budgets within a hospital pharmacy can be quite large, monthly going into the millions of dollars. So we need to ensure that we have a good fiduciary responsibility, not only to the health system, but also ensuring the best medical care that we can for our patients.
Right. So it sounds like a healthy mix of pharmaceutical duties with also some business duties as well to ensure that you
Yes,
guys are
definitely.
running and up and able to
Yeah.
provide a service to someone. Um, so with our, I feel like this is something that is probably being spoken about a lot amongst our alumni constituent group. Um, the vaccine and the current state of the vaccination process right now, which seems I feel like it might be a little overwhelmed right now, just from what I've heard in the news. I kind of just wanted to know, like, what's your take on like the current state of the vaccination process? Is there anything that our alumni need to be aware of, or is any tips and advice, or just general comments you have on the whole vaccination process right now?
Yeah. So there are, I think everyone's really worried, as especially, am I going to get the vaccine? When can I get the vaccine? Um, what we're seeing in the media is there is a lot of truth of what you're saying. It's hard getting the vaccine. We do get limited supplies. Um, And I think the thing that we really need to acknowledge is that everyone will have the opportunity to get the vaccine, but I think we just need to be a little bit more patient. The initial rollout and the assumptions that we all had, including my family and friends, was that the vaccine, everybody was going to be able to get it right away. We here are working to try with the local government as well as federal to get as much vaccine as we can, but there's just a finite amount that we can get each week.
Mhm.
And that's what I think people need to understand. The vaccine is there. It's, a matter of just waiting, and unfortunately waiting in line, and those lines can be long. The other thing that I know that can be a big frustration for even seasoned computer literate people, and not to say that the elderly population is having an issue identifying where and when they can get the vaccine. It's I think one of the things that we could do better, whether it be state and federal, is making an easy pathway for people to log on to, maybe have one portal that would help a lot for a lot of patients. And I think that's where a lot of the frustration comes in. Um, right now it's kind of a waiting game to get those doses, but when they come, you know the vaccine is safe. That's one of the main things that I want to impart,
Mhm.
is that when you get that vaccine and you have the availability to get it, the vaccine that we have, whether it be the Pfizer BioNTech or the Moderna vaccine, they are safe. They're mRNA vaccines, um, and they're a tool that we have now to keep people out of the hospital. We have this tool that will help get us back, and I said this in other forums, to get us back to normalcy.
Right.
We just need to, wait a little bit longer.
I think if many people have waited a year, I think another month or two, I think is going to be really beneficial to societies in general. So it sounds like patience is the key right now. Um, and I think trust the doctors and the research and everything. Would you recommend any resources that maybe our alumni can use to get like real time updates regarding just anything vaccination related that could be useful to them?
Sure, the CDC website is a great resource. They provide information on the vaccine a whole. They provide specific vaccine information for the Pfizer, BioNTech, as well as the Moderna vaccine. So if a person had a question, or wanted to know a little bit more about what's the difference between the Pfizer vaccine versus Moderna, that's an easy, quick way to look up. On the CDC website, there's also updated information about different categories of patients that you may be looking to, vaccinate. And it answers a lot of questions, provides up-to-date information. There's also a lot of resources regarding trends and patterns that are happening across not only New York, United States, but again, around the world.
Mhm. So I will definitely link that CDC link in the description for our alumni if they want to take a look at that and just see the resources that are available to them so that they
Mhm.
can stay as up to date and educated as possible on the current state of affairs. So then I kind of want to get into as well now. uh, I guess your opinion on how you kind of just see the next 6 to 12 months playing out as a whole, and um, should we be optimistic? Should we be looking forward to, is the end in sight maybe?
I was doing some research before this call, and the numbers show that we are on a plateauing toward a downward trend of the cases. Um, when you look at other, numbers, certain numbers go up, of course.
Mhm.
But what we're seeing is that as a whole, we are trending in the right direction now, where we are going to be coming down over the next even 4 weeks. we're looking at the numbers, while large, are actually smaller than what we've seen in the previous months. You know, after the summer and up until now, we started to see a big uptick,
Yeah.
and we're starting to see that tick come down as of about a week or two ago. So, and that's a really good thing. And if you ask me, is it attributable to the vaccine? I can't say yet. But there are other things that we are seeing decreasing. We see decreases in the flu. Why is that? Because everybody's taking much better care of themselves. They're wearing a mask, they're social distancing, they're washing more. And so while normally last year this time we had huge, red zones of flu, now we're in the green and even lower.
Mhm.
So everything works out in the end, and I think what you'll see is over the next couple of months, we will continue to have a decrease in the number of cases.
Awesome. So it sounds like people just need to stay as patient as they can, keep following the guidelines that they have, washing your hands, wearing the mask, practicing social distancing, and I think I don't know. I think people can be optimistic.
Yes, definitely. I think it's you need to be optimistic. And the thing is even if you get vaccinated, vaccination doesn't mean that you can stop doing all the precautions, right? And that's a key thing is we need to continue to wash our hands, wear a mask, social distance. And that's really how we're going to achieve what we need to with the introduction of the vaccine. And moving forward, this is really it's a multifaceted approach, and we just can't rely on one facet, and we see that, and it's working out to everyone's benefit now.
Right. Well, this was great. I just wanted to thank you again for taking the time to meet with me today and give me an opportunity to provide dialogue like this for our alumni who maybe just want another point of view on the whole current state of affairs. So thank you again, Dr. Longo, for taking the time to be here.
It's my pleasure.
Have
Thank
a,
you very much for having me.
of course.
Thank you.